Hello, everyone. Welcome back to another episode of Coach Krisler's Combos. Today, I am joined by Dr. Brown. I'm going to let her introduce herself in just a minute. But for those of you that are new here, this is a place where we have conversations about people's personal experiences with a variety of different things. So I want you to sit back and relax and listen in. Hello, Dr. Brown. How are you? Thank you so much for being with me today.
Thank you so much for having me. I'm excited to be here, Krisler.
Yes, thank you so much. I appreciate your time. I know you're a busy woman, but we're going to talk a little bit about your health journey. But before we get to that, tell us, who you are, where you are from, and what you do.
Sure. So I am, I'm Funke Afolabi-Brown. I am a sleep physician. I am also a sleep advocate, and I speak and teach and coach and consult on all things sleep, specifically in women and children. And I really help people just like you move from just overwhelmed and exhausted to thriving using sleep as a tool. And so this motivated me to start Restful Sleep MD, and that's how I do this. So I work one-on-one with individuals, but I also work with organizations, as well as I am going to be opening my own clinical practice. I am currently employed, but will be opening my own clinical practice just to really sort of complete this process. And I'm excited to be here. I am originally from Nigeria, and I am in my home now in Pennsylvania.
Awesome. That is so exciting. I love this topic of sleep. I think in American culture, we do such a disservice centered around, busy life and hustling and not sleeping, and I'll sleep when I'm dead, and all those types of things. And I'm like, well, you're gonna be dead sooner than later if that is your mentality. So I really want to dive into this topic of sleep. Tell me a little bit about how this even came up for you. Like, why did you go towards this path of sleep?
Yeah, so I think really for me, it was personal. So I, as a physician, right from the minute you sign in and say you're going to medical school, it's like you're sort of divorcing sleep. Like, okay, I'm going to medical school, meaning I'm going to part ways with sleep. Like it was an unwritten rule. So I was exhausted all the time, right? So that was even in training, right? Reading, burning the candle on both ends, trying to compare myself, trying to do well, right? Because I don't want to fail. And then even when I started even after I became a doctor, I carried that narrative into my residency and my fellowships. And during that time also, I had my own kids and I had loss in my family. So I had a whole lot of things that were contributing to both sleep deprivation and insomnia, and they're completely different, and people just kind of use them together or whatever. But I had both. So it was more like there was no opportunity to sleep. And even when there was opportunity to sleep, I couldn't sleep. And so I walked through that stage, and it impacted my health, my mental health a lot, and my performance and my relationships. But eventually when I was able to sort of own my power back, which is why I call sleep a superpower, build boundaries around it and start to really prioritize it, I saw the change. And so that got me interested in okay, let's dig deeper into what this is all about. And so I went in and got a fellowship in sleep medicine to really get the science and do some research on it. And then, back in my clinical practice, which is where I spend a majority of my time, it was the same. It was more of, even though my child has sleep apnea or my child has some issue, the parents are not sleeping, and so I really started to see this from, oh my goodness, I've been here before kind of perspective. And so that motivated me to start Restful Sleep MD, because I feel like by the time the child gets to me, we're talking months and almost years of families struggling. And so what can I do to empower families really early on to start to look at sleep health in a different way? and to start to implement, preventative, proactive strategies so that they don't start to suffer from the long-term consequences.
Wow. Wow. So, I'm thinking as you're talking about the medical school part of it, I'm thinking about other doctors that we've had on the show, and so many of them have talked about being in medical school and not sleeping. Dr. Evan Hirsch, for example, talks about when he started his practice, sliding underneath his desk and trying to take a nap during the middle of the day because he was struggling so bad. And I just think, isn't it interesting how these medical doctors, these in training, it's like we expect them to retain this knowledge and make decisions for people's health, and yet they're not getting sleep. Like they're, having the mental capacity of a drunk driver because they're not sleeping. And so I'm really curious, did you notice that your those that you were in school with were struggling with the same things, or was that just something that you really kind of focused on yourself with? Yeah, well, it's just how it is. So,
No, everybody was, but we couldn't put a name to it. We just didn't think it was a thing to prioritize sleep. It was more of, okay, when is my next cup of coffee? It was brutal, right? Or what is the next thing I can do to just stay awake and keep my eyes open to be able to study through the night? And how do I make sure that I don't sleep through my test? When I
what
eventually
did you learn about sleep in medical school? Did you learn about sleep at all?
Nothing. It was more of almost like a drive-by. I mean, I think, I think now maybe there's like a total of 2 hours given towards sleep education. And I think, what you're saying is just so true about the fact that, and that's another, organization, structural body that I work with, which is training institutions and healthcare industries, where people are still sleep deprived. Now we know without a shadow of the doubt, there's a high rate of medical errors when you are, related to sleep deprivation. There's increased risk of fatality, accidents, things like that. There's like the Zion's law, which was really, really sad. But even though there's been like a lot of, move towards regulating the number of duty hours that physicians, especially physicians in training, get, it's still not good enough, because on paper, they're supposed to work less than 80 hours. But most times, trainees are going home and their brains are not shutting down. They still have to run around and do errands and stuff for their homes. They're still trying to finish up some charts or feel guilt around maybe decisions they made. So there's still a whole lot going on in the background. And then even after training, right now, you don't have anybody looking over your shoulder and kicking you out of the hospital when you're done with your night shift. As attendants, as physicians, nobody's looking at that. Nobody knows what I'm doing. I just show up. Nobody knows whether I'm sleeping 4 hours and going into, like you said, do brain surgery on patients, right? And I tell people, the same way you wouldn't want a drunk pilot or a sleepy pilot flying you across the country. You don't want your physician to be sleep deprived. And it's really time to start to shed light to that, because the kind of decisions we make are really, some of them are life and death decisions, and it makes a huge. And then when we talk about burnout in the physician community and suicide rates, right, it's all related.
Absolutely. So as you mentioned, you went through your training and residency and all of these different things, plus having children. So how many children do you have?
I have two.
2 children. Okay.
Yeah.
And so you had 2 children both during this time frame, I'm assuming. Okay. So I also have 2 children, and I understand that whole life of newborns and figuring out that whole thing. So for you, what was that transition like, going from, medical school and doing all this training and becoming a doctor and then becoming a mother and having that additional stress of learning that life too?
Yeah, it was hard. It was hard because, first of all, the thought that one, I wasn't training, so I was holding myself, right? It's
Mm-hmm.
especially as women, we create this like ridiculous standards for ourselves and nobody else, you
Do it
know?
all. Right.
Exactly. So I was holding myself to a standard where I felt like, okay, I made the decision I was going to have kids in training and nobody is going to know that I even have kids because I'm going to just work myself to the bone. I'm going to show up and perform like I don't even, because I don't want empathy. I don't want people saying, oh, she's slacking because she had kids. So that
Mm-hmm.
already put me in a mindset of hyperachiever. You have to do it at all costs, right? And
Mm-hmm.
then on top of that, I had the emotional guilt I had, right? I left my kids when they were very, very young to go back into, after you don't really necessarily have maternity leave, to go back on minimal sleep because I was like nursing. So I would be up doing call, back home, feeding, nursing, nurturing, taking care, being present, and then back again.
Mm-hmm.
And feeling guilty. So no matter how hard I tried, I felt guilty that I could do better at work. And I
Mm-hmm.
felt guilty that I could do better at home, and I wasn't sleeping. And because I
Right.
wasn't sleeping, your empathy for yourself is in the toilet. So
Mm-hmm.
it was a hard season. And so, and I was, and this is not, these were some of them, I felt like these are the decisions I make. I need to own them and I need to just push
Mm-hmm.
through and things like that. So,
Mm-hmm.
and I hadn't been, exposed to coaching at that time to let me know that, oh, wow, a lot of these are coming from these thoughts that are leading to this behavior. So this was, way back then, right?
Mm-hmm.
So I would say it was a tough season and I felt very helpless, but still felt like I just had to keep doing it. And I think that
Mm-hmm.
was when, like, the sleep deprivation, the insomnia then would, create moments where I would feel so anxious and overwhelmed and things like that. So definitely a hard place to be. I'm glad that season is over. And I think that really helps me connect with my clients too, because for me, I can tell you I've been there. I know what that feels like.
Mm-hmm. Yeah. So I want to talk a little bit about you mentioned that your mental health really suffered. Was there a moment in time or was there, set of circumstances where you're like, oh gosh, this is really too much for me, or where you kind of recognize that this needs to change?
Yeah, I was. I think initially I was kind of pushing through, but I think especially as my kids started to be more aware, like, I realized it was just impacting my relationships at home, right? I had
Mm-hmm.
zero tolerance level, so I was taking it out on them. So I'm still out there, right? I'm a woman. I'm a strong woman. I'm, all that good, all that stuff, right? So you couldn't tell, but the people that were closest to me were suffering for it.
Mm-hmm.
And my performance was suffering. Of course, I could mask it to some degree.
Mm-hmm.
So I think, eventually I was like, no, this can't keep going. We can't keep. My intention when I wanted to raise kids was not to create an environment where they had no clue what they were going to get in the morning.
Yeah.
So I think that piece for me was the big one. Like, I don't want to be this way anymore,
Mm-hmm.
and something has to change.
Yeah. It's amazing how reflective our kids
Mhm.
can be to us.
Mm.
You start to do things and you see either on their face, they're like,
Mhm.
or they even say things.
Yeah,
Our kids will say things like, mommy, you look really mad, or
yeah.
something, and you're like, wow, okay.
Hmm.
They kind of become our little teachers.
Hmm.
And unless we stop and listen and pay attention to that, we will continue on that same path.
Yeah, yeah. No, that's so true. That's so
Yeah.
true.
Yeah. Well, good for you for recognizing that,
Mhm.
right? And making changes that really benefited you, and then of course are going to benefit your family as well.
Mhm.
Yeah.
Mhm.
So now that you are, on the other side of it, so to speak, and you
Mhm.
know what you know, and you've had those experiences, how do you think that really helps you with your patients?
My patience or patience?
For the people that you're helping.
Oh, got it. It helped both. Right? So first of all, the kids didn't change, right? But then a calmer version of me saw things differently when they were taking their good old time to tie those shoelaces as we're rushing out the door. Or but there wasn't a bloodbath. It was more of, okay, let's think through how we can move more efficiently. You know what I mean? Like all of a sudden started working together as a team, and that's been proven in science. Like even team building improves when you prioritize sleep, empathy improves and all that. And I think for my patients, yes, it's completely changed the way I interact with them, because I am coming from a place of someone who's been there. And I am not giving you recommendations that are just off the cuff and saying, okay, here are the 20 sleep hygiene tips, see you later, right? I am like sitting with you and thinking, how can we build this in a system that's practical for you, for your family, for your particular situation? Because I know if anybody came to me and said, well, get 7 to 9 hours of sleep at that time when I was burning the candle at both ends, for me, it would have been like, how?
Yeah.
Right? Like,
and even adding a stressor of now I got to get all this. What do I do?
Exactly. So I think that has helped change the way I work with clients, the way I work with my patients, changed the way I place demands on others, and also on myself. And it's taught me a whole lot about boundaries too, right? Because like I said, okay, it's whether we want or not, yeah, we should be getting somewhere close to 7 to 9 hours, but how can we implement that practically for a mom who has, a job and 2 young kids, and is also like has all these obligations, maybe taking care of an older, an elder parent, and by the way, maybe has a side gig. Like, how can we create a system for you to thrive and for you to be confident in achieving good sleep? We have to really drill down, but it took me walking those shoes, not just reading the textbook, to be able to combine the science with the heart. And so I think that's what this journey has helped me do in a way that's unique for my clients.
That is phenomenal. Yeah. I mean, I can just hear how much love you put into working with people, and using that experience. You don't just say, okay, this is what you need to do, but thinking back on your personal experience and knowing, okay, I need to have some practical things, right?
Yeah.
What can I do right now in this season of life that actually is going to work for me and isn't this big lofty thing that's going to add additional stress?
No, and I think that's what helps us get the results, right? I'm sure you experience the same with your program, where it's like, I'm not just giving you some tools. I'm like, let's sit together and see how this can really work, because everybody has good intentions. Everyone wants to eat right, sleep right, exercise, and be good.
Yeah.
But then how do we do it in a way that's applicable to each person? And we all have our unique stories. So
So for you, what were some things that you found that were helpful in helping you get good sleep, helping you maybe to sleep longer, or, if you woke up in the middle of the night, falling back asleep relatively quickly? What were some things that helped you?
So I think first it was an awareness, like, first understanding what was going on in my body. So I had to listen, because all I felt was I'm tired all the time. It wasn't like I'm not sleeping well. And that's the same thing with my clients. They're not necessarily saying, I am not getting 9 hours of sleep, please help me. They are saying, I'm exhausted and everybody around me just irritates the crap out of me, or I can't seem to keep my eyes open when I'm at a stoplight, right? Or you know what I mean? Or I live in a constant fog. So for me, it was a combination of all that. And so I had to do almost like a root cause analysis to say, where is this coming from? In my relationships, in my own health, in my mood, in my mental health, right? So I had to kind of dig deep and trace it back and see where it was starting from. And it started for me from the moment I woke up in the morning. And so we're like, oh, okay, that's interesting. And so then I could make that connection to sleep. Because otherwise, that's what happens, right? You go to your doctor and say, I feel irritable all the time and my heart is racing, and then they put you on an anxiety pill.
Right. Right. They
Right?
don't talk to you about your sleep. They don't talk to you about how
No.
you're doing during the day or your job or your
Yeah.
environment. So
Yeah.
those
Yeah.
types of things. Yeah.
Yeah. So which is why, you know, this is what I do, right? It's like, this is where you're going. We're going to use sleep, but let's just put that on the side first and figure out what's going on, what specific area. So it took doing that. And I realized, oh my goodness, I need to protect my sleep. And then I had to build systems around that, protect
Yeah.
my mind before I go to sleep, protect my sleep environment, create my sacred space, protect, my routines, teach my children to sleep well, because if they were not sleeping, I was waking up all night and then I was feeling horrible in the morning, right?
Yeah.
So
Yeah.
I wasn't until I figured that piece out that I could then build systems to make sure that sleep was, I harnessed it. And that's what I call it. It's like harnessing sleep as a tool for me. But it wasn't just like, oh, I'm just going to jump into bed, right? And so that's how it's kind of worked.
Yeah. When you talk about sleep hygiene, which I want you to define that in just a second. But I think about how my nightly routine has changed, and just thinking about, slowing down in the evenings and taking a hot, Epsom salt bath, and, having my room be dark at night, and, those types of things has changed things for me. And so tell us what you mean by sleep hygiene for those that may not have heard that concept before.
Yeah. So I tend not to even use the term sleep hygiene, because I just feel like hygiene sounds like clean. Does that mean if you're not sleeping well, you're not clean? So I kind of just talk about healthy sleep habits. And I think these are practices that can improve your sleep, right? Now, I'm very cautious about defining that, because I'm not telling you it's going to be the treatment for insomnia. It's not going to be the treatment for sleep apnea, restless leg syndrome, or narcolepsy, or other sleep conditions. It'll be part of it, but they're just foundational basics that improve our sleep health, just like brushing your teeth twice a day, just like flossing, just like, you know what I mean? Like, just like eating healthy foods, drinking milk, or whatever it is to protect your dental hygiene. It's almost the same thing. So how we can set ourselves up so that the foundation is right. And then when the foundation is right and you realize, wait, the foundation is right, but things are still off, then that lets you know, I need the extra help.
Right.
So I cannot see everybody. I cannot coach everybody, but I can empower people with the information they need to at least get started on. I didn't even know I wasn't supposed to be holding a phone next to my face before bed. Okay, sleep hygiene. You shouldn't be doing that, because so that's really, I think that's what it should be used for, not as like, this is going to fix all your sleep problems, but this is where you want to start. And I could tell you, for thousands and thousands and millions of people, probably that's all they need to improve their sleep. Just really that awareness of what are the things I need to do to promote good sleep health.
Yeah, I love that personalized approach, because, you mentioned the phone, for example. For me, I sleep with my phone in another room. But I also don't have children that are old enough to be out at night. So if I was going to expect that of a mother of teens, or, early college students that may be out working late or at a party or something, they're going to want to have their phone near them in case of an emergency, right? So there's this personalized approach that you take. And I find this as well with coaching, that maybe that doesn't work for you. So what else, or what other options are there, right?
Yeah. And I think it's so liberating, because people don't then feel like, oh my gosh, because I have my phone next to my bed, I'm never gonna sleep well. Or I'm breaking the rules. But that's not the case. I think that's why we have to tailor this. Or if you think of sleep inequities, right? I live in a noisy, unsafe neighborhood. So I'm never going to sleep well, right? So we have to really take what the person is really experiencing and find the way that we could sort of bridge the gap based on what their needs, based on what their nuances are. And I think that's really important.
Yeah, that is very, very important. And I'm glad you brought that up, because there are so many things I think that people don't realize could be affecting a person's sleep. Like you said, living in an unsafe neighborhood, right? You know, those types of things are things that you're aware of. And because of that awareness, you're like, okay, what can you do? Right? You can't take away the noise, right? But you know, there may be other practices that you can put in place, as you said, to protect yourself or protect your sleep, or build a stronger foundation, right? That could help you.
No, absolutely. And I think this really empowers people, right? It does. And that's the mission. So my mission is not that you suddenly have perfect sleep, but again, you develop that sleep confidence. Like, I don't feel disempowered. Like, and so I can't tell you, oh yeah, get blackout shades or get this, that, and the other, and or make sure you, no matter what happens, you have to be in bed by 7 p.m. if you're working jobs, if you're working shifts, 2 shifts, because you're trying to feed your family. So I think there's so many nuances to this. And again, I'm kind of using your experience, I'm sure, as the same, which is we really have to tailor things to what people are experiencing, to what they're going through, and to where they're going.
Absolutely. Yeah. So, what are 2 things that you do now to really protect your sleep and prioritize sleep? What are 2 things you do personally?
So for me, it's first of all, boundaries. So that's been a big one. And so, there's, and I sometimes say this too, that sometimes it's not even a sleep issue, it's a boundary issue. And many times the way we do one thing is the way we do all things, right? The way we do sleep and treat our sleep is probably the way we treat ourselves on our day-to-day walk. So if I put my sleep on the back burner and let everybody, my boss, my kids, tennis coach, my, social media, the news, I bring them all into bed with me, right? So that's something that is, then probably that's going to not facilitate healthy sleep. And I'm someone who's very sensitive to things like that. So I protect my sleep that way. So I know that at a certain time before my bedtime, so even though for me, again, figuring out how many hours of sleep you need, for me, I need somewhere between 7 and 7.5 hours to function fully. And the way I could do this, the way I could figure this out is because even when we're on vacation and I have no schedule, my rhythm is set such that that's about the time when I wake up. So that, and I think that's the important thing, to figure out how much sleep you need. And it's so unique to everybody. And then realizing that if I need 7.5 hours, I can't start getting ready for bed at the 7.5 mark. I have to create time for my routine. So I wake up at 5:30. I'm an earlier bird kind of person. And so then that means by 9:30, I'm starting to wind down. I have to create so that when I'm in bed, there's adequate sleep opportunity. But see, if I'm just putting my phone down at 10 p.m. because I need 7.5 hours, then I'm not going to get that 7.5 hours, right? So that's where short sleep and sleep deprivation starts to feed in. And so I create those boundaries I set reminders on my phone to say, get ready for bed, it's going to change your life. So I make it like an appointment. And at the same time, the do not disturb, automatically, or the focus feature on my phone sets in. So the only people that could get to me are the VIP, right? My family, people that I know, okay, they realize that sleep is a priority for me, but they need me. Not everybody needs me. People can wait, right? And so I think that's been the biggest mindset piece for me, in terms of how I prioritize sleep. And then the second thing I do my routines are they're so predictable. Like you can literally know where I'm going to be at every point in time because I'm a woman who's very creative, right? I have all these beautiful ideas, but guess when they come up? They come up when I'm in the shower or as soon as my head hits the pillow. So I have to be proactive, right? I'm like, this beautiful brain is a gift. I'm not going to suppress those thoughts. I'm going to just find a different way to express them. So I do journaling as part of my routine. So again, this is why it has to be something that works for you. So like you, I take a bath because I am so sensitive to temperature changes, and dropping my core body temperature helps my brain start to get ready because it's starting to release that melatonin, right? I do the journaling and spend time meditating because I realize I need to quiet my mind and be present. I do the journaling because ideas are popping up from all over. There may be some worries, there may be, so that's when I'm doing that. That's when I'm meditating. That's when I'm praying. So I make that part of my routine. So I think those two things has been really the biggest game changer for me when it comes to prioritizing my sleep.
Yeah. Wow. Really cool. And it, you have definitely created some important practices, not only because you just have heard they work or saw somebody else do it, or the science behind it, but because it's become so important to you and you have such a self-awareness of what your needs are, because you are a creative person and as soon as you close your eyes, all the great ideas come, right?
Yeah.
Because you know that and you're aware of that, you're able to put into practice something that addresses that for you. And I think that's what's so important, again, about this personalized approach that we take, is that you will have people who are like that. They're like, why do I get all my ideas when I lay down, right? Why won't my brain just shut off when everybody else's does? It's like, that's okay. Embrace that about yourself. Let's find a way to kind of, push that towards a direction that's beneficial to you, but also what's a practice that could, calm your brain and things like that. So that's phenomenal. Well, I have had such a wonderful time talking to you. I feel like I could ask you a million more questions. But I know you're busy. And so, I want to be cognizant of your time. But for those that have been listening and they're like, oh my gosh, that's me. I want to know more. I want to ask more questions. Where can they find you?
Thank you. I've had such a great time talking with you too. And I think we've delved a lot into the mindset piece of sleep. It's funny, we didn't talk much about sleep hygiene, sleep disorder, insomnia, because you know what, when you miss that initial layer, then it's the rest is doesn't really hold its own. So definitely, if you're looking to hear more about the work I do, I'm on Instagram at Restful Sleep MD, and I put out content that helps just kind of help you see sleep in a different light, right? And then if you are a woman, like I've described here, where you realize that sleep is probably not where it should be, and as a result of that, I'm struggling in whatever that dimension of my life is, whether it's my parenting, whether it's getting clarity, whether it's really even implementing or achieving my goals, whether it's setting boundaries so I'm not overstretched, then we need to talk. Get on a call with me. I'm at restfulsleepmd.com/work with me. And I do offer a 30-minute free consultation where we'll just I'll listen, and then we could talk about if there are ways that I can help you get to where there is. When it comes to your sleep journey, then we'll definitely be able to talk then. So those would be the main places to reach out to me.
Great. Well, I will put that information in the description below our conversation. Again, thank you so much for jumping into the conversation with me. Sleep is so important, and I think you are a great resource for those out there who need help in this area. So check out Dr. Brown, y'all. Follow her on Instagram. She provides such great just ideas and tools, and like she said, a different way to think about sleep. So it's a great account. Follow her there. And for all of you who are out there and watching these conversations, thank you so much. Make sure that you like and subscribe so you don't miss any of the combos. And I will see you next time. Bye. Bye.